Should GPs be prepared to support, prescribe, on the advice of a private consultant, the management of chronic Lyme disease? Well, this is the challenge, absolutely. The guidelines say treat 3 weeks with antibiotics, and this is the situation for Lyme disease. Some GPs are very reluctant to prescribe within the NHS or in Ireland on medical cards antibiotics that do not fit these guidelines. However, for example, I treat people with cellulitis. The guidelines say 500 QDS of flucloxacillin, but very often in the hospital, in order to get patients discharged safely, and for patients with poor peripheral circulation, those with lymphedema, those in Ireland who've injected and lost their venous supply and their lymphatic supply, they often take 3 to 6 weeks of higher dose antibiotics to treat. So you look at the guidelines, it says flucloxacillin 500 QDS. Very often we will prescribe a gram QDS for 2 months in some of these patients. Now, do you send them off without any monitoring? Absolutely not. Every patient should be monitored appropriately. But I think we should be treating patients. We should be offering patients appropriate treatment, and we should be doing the appropriate monitoring to monitor for benefit, immunological inflammatory markers on treatment, and also toxicity, side effects. All antibiotics have side effects, but the side effects of these antibiotics are less than 5%, if not less than 1%. So monitoring patients with full blood count, renal, liver, bone chemistries on a monthly, every 2 months, every 3 months patients on treatment is a perfectly appropriate thing to do. However, patients are currently being seen privately, and these are private prescriptions, and it is totally up to the discretion of the GP whether he is willing to re-prescribe antibiotics on NHS and other public prescriptions. It is totally at their discretion. However, I would encourage that GPs continue to learn from the patients and learn from private practitioners who are managing Lyme disease, because this truly will benefit your patients.